Hi everyone, here's some vaccine news that you can use. As of September 8th, 71.4% of Chicagoans 12 plus have received a first dose of vaccine. That's 60% of 12 to 17-year-olds and almost 75% of 65 plus. 65% of Chicagoans 12 plus have completed a series. That's 1.5 million people. We'll be getting more information on boosters over the next 2 weeks, but even when boosters start, initiating or completing the primary series is critical. There's no question that we are in the middle of a Delta variant surge right now, and new hotspots are popping up, as you can see here on the map in red. FDA and CDC are still reviewing data to guide booster dose planning, and the FDA even announced a VRBPAC meeting for September 17th, which will help us to prepare. In order to estimate the possible volume of booster demand at your clinic, you should run a COVID immunization activity report in iCare. Select for date ranges according to your first 2 months of first and second doses to forecast the number of booster doses you may need to provide 8 months from their second dose. You can generate these reports on the computer screen or as an Excel file. The data will give you patient name, date of birth, brand of vaccine, and other shot info. Once you have this list, it's important to ensure that your reminder recall processes are in place and effective. Check out the CDPH resources on reminder recall on the Vaccines for Children Health Alert Network page. For the time being, we're still focusing heavily on encouraging people to start their primary series or finish an incomplete series. If your patients have transportation issues, please remember to refer them to our Protect Chicago at Home program by calling 312-746-4835 or have them visit chicago.gov/at-home. As you can see here, we still have plenty of capacity in all regions of the city. The yellow line in the graphs being appointments scheduled and the gray line being our max capacity. So please send your patients to our website and hotline. Once ACIP and FDA approve an interval for boosters, iCare will have reports available to allow you to forecast appointments with vaccines due reports for your patients, as shown here. These slides and more on iCare reports are available on the VFC Health Alert Network page and the COVID provider page. Another update for the week had to do with vaccine mandates, and this may drive more volume to your clinics. On September 3rd, Governor Pritzker extended the deadline for mandatory vaccination of healthcare workers, now requiring that healthcare workers have received their first dose of vaccine by September 19th, and the second dose within the next 30 days. If this applies to your staff, you have a little bit of extra time, but this is incredibly important for the safety of your staff as well as your patients. Also, President Biden announced new vaccine requirements that will cover 100 million additional Americans, which is 2/3 of the U.S. workforce. The Department of Labor, through OSHA, will issue an emergency rule in the coming weeks requiring all businesses with 100 employees or more to require COVID vaccinations or get tested weekly, and will require these businesses to provide paid time off to employees to get vaccinated. Thanks for listening and for making Chicago safer, one dose at a time.